appreciate it. So I'm just going to look, and if you're on that side of the table, you can't see anything that I'm doing. And feel free to squat down here or whatever. If you want to block me off the camera, I'm good with that too. So, okay, so I'm just going to look, and everybody can see this line right here? Okay, so that's it right there. Right in there, right in there, right in there. Goes into there. We won't be able to palpate it any further. And so once you see that, Cody, I'm just going to like grab on with both hands, okay? Okay. All right, just wanted to warn you. So I'm just going to come in here and grab onto it. That's it right there, just like a big hamburger. Okay? Now, you're going to be in your partner's armpit. So if it was an actual patient, I'd probably warn them because that's kind of a sensitive area. Are you okay with me being on there? Okay, thank you. Like, what are you going to say? No? You could absolutely could if you wanted to. Did everybody see when he laughed how easy it was to see the indentation of it? Okay. So right there, right? Okay. And so I probably have some of the teres major as well, because what's teres major? It's Lat's little helper. So I'm going to feel on this border, and it's like kind of slipping out of my hands right there. I'm going to try to follow it up. I'm going to switch to a flat palpation so I can feel it up there as far as I can. Okay. All right. So as I come here, what's happening here, and even though Cody is super lean, so it starts to feel more kind of gelatinous because it's more skin and fascia and fluid, and I really start to around here start to lose it. Right at this point now, I'm really just holding on to skin because what's happening is it's getting thinner and thinner, right? And it's coming up like that, but I'm not really going to be able to palpate that section. So my only expectation is that I would just do exactly what I just did. So stop, take a look at it, see where it is, come on in, grab onto it, follow it here until you feel like, okay, I'm losing it now, all I've got is skin. Come on back. Switch to a flat palpation. I kind of feel it gets more tenderness. And then how it gets in underneath that deltoid. Okay? Any questions? That's all I want you to do. Yeah.
They have like excessive amount of adipose tissue. Is that going to be on top or underneath the lat?
It's going to be on top. It's going to be harder. It's going to be a little bit harder, but let's say when we went to look at it, we saw no definition here. You would still be able to come up under here and grab onto this tissue. So the only difference would be I'd have more fat tissue in between my hands, but I'd still be able to appreciate that that's the lat. Okay? And the truth is that most of your patients will have more adipose tissue than Cody has, so, which isn't much, it's very lean. Okay?
Can they like position their arms in a certain way to where you can see it better?
Yes, thank you for saying that. I almost forgot that. All right, so I'm going to roll back. I don't want to get on somebody's toes. Okay, so one of the reasons I have him in this position with his arm on the table is because in this position, it would be very easy for me to resist, and just relax, rotation, right? Mm-hmm. So the lats is a medial rotator. So if I make medial rotation contract, his lats will pop up, in theory, right? Okay, so if I'm going to have him resist medial rotation, I'm going to come down here by his hand and go ahead and just push against my hand. So there it is right there. Everybody see that? Mm-hmm. Good. If I wanted him to resist lateral rotation, I would go here, push against my hand, okay? So one of the things that you can do, is this as high up as this table will go? Yeah, let's go ahead and bring it all the way up, Tony. So, good. So a couple of key things to this that you need to listen to. If I have him resist here, go ahead and push against my hand. Now the lats are still firing there because it's extension, but I'm really just doing adduction actually, right? Everybody can see that that's adduction, that's not medial rotation. In order for me to get rotation, I have to be down here or here, okay? So you want to if you want to keep your hands free, I can say, feel that's my knee right there. Go ahead and just push against my knee, and then my hands are free. Okay? Okay? Be mindful of the words that you use. So don't say push against my thigh. Just, just be, that's my knee, and I would make sure that's my knee right there. Can you feel that? Go ahead and push against my knee. So it's as kind of as clean as you can get it. Okay? We good? Okay, grab a partner. Thank you.